We'll talk about it more later. That's just the introduction. So the 1990 criteria for fibromyalgia required that a patient had to have body pain. And I'm sure you've all seen this before. This is a common diagram. And this happens to be out of my book. So unexplained widespread pain, 11 of 18 tender points. The majority of these patients also have migraine. Most of them are middle-aged females. Gastrointestinal issues, 50% meet criteria for irritable bowel syndrome, debilitating fatigue, and some other manifestations as well. So again, 1990, to be diagnosed by a clinician, the patient had to have these tender points, widespread, unexplained body pain. The criteria were rewritten in 2010, and in 2010, you had to have a body in order to be diagnosed with fibromyalgia. So, who do you think funded these criteria?
Somebody sells drugs, man.
So these were, the criteria themselves were funded by a drug company. The authors of the criteria were funded by multiple drug companies. So what do you think their conclusion is? The conclusion is that we need to diagnose more patients for longer duration and exclude the need for a physical exam. Why in the world would a medical organization want to exclude a physical exam for something that clinicians should be diagnosing, right? It's because they wanted to turn fibromyalgia into a checklist diagnosis that people could diagnose themselves on the internet, come into the doctor with a checklist and say, look, I have this, I need the drug, right? So it took control out of the hands of physicians and put it into the hands of the patients, in this case, so they could diagnose themselves and demand drugs. Funded by drug companies, the authors were funded, removed clinical examination, like I said. So previously, the diagnosis was based on physical exam. And now, the whole thing was turned on its head. Broaden the range of who can be diagnosed, we'll talk about that in just a moment. Prolong the diagnosis, like that doesn't benefit doctors or patients, right? You'll see that most of these changes don't benefit doctors and patients, they benefit drug companies. So part of the point, if we wanted to look at this from a purely academic standpoint, is that when you look at research on fibromyalgia, you need to see if they use the 2010 or the 1990 criteria for diagnosis. If they use the 1990 criteria, most good studies use a combination of the two. But you want to make sure that they use the 1990 criteria. If they use the 2010 criteria in a study, it could get pretty sloppy pretty fast. So I think that they did this obviously to sell drugs, because they intentionally, and they state this in the article, it's not like I'm reading into this, they intentionally wanted to broaden the number of patients who could be diagnosed and to lengthen the time of diagnosis. Again, that doesn't benefit anybody with a drug company. You'll see that they also made it basically an add-on to any condition you can imagine. So previously, fibromyalgia was widespread body pain with fatigue and sleep disturbance and gastrointestinal disturbance. Now, fibromyalgia is seizure, Raynaud's syndrome, peripheral neuropathy. So it's just an add-on to diabetes. It's an add-on to all of the autoimmune diseases. And, of course, they're just selling drugs hand over fist. My concern, so that's what I thought for years. And then when all this vaccine information started becoming as popular as it is to the point that no one can avoid it, I looked again at the criteria for fibromyalgia and I thought, that's vaccine injury. So imagine, I'm just making this up on the fly like I do just about everything. But imagine being a young girl, because who's affected by fibromyalgia? Mostly younger girls-ish, teens, 20s, 30s. Who gets the HPV vaccine? I'm just using that as an example, right? So how easy would it be for, let's say, me as a busy medical doctor working in a community clinic or whatever it is, I could say, no, you don't have vaccine injury, you have fibromyalgia. Wow, we just covered up a catastrophe. So who funded this diagnostic change? The companies that make the vaccine. That doesn't mean what I'm telling you is right. It just means you got to think about that stuff. So we as clinicians, of course, have to differentially diagnose our patients. We don't just take patients who come in with a checklist and say, look, I diagnosed myself with fibromyalgia on the internet, right? You as the clinician has to say, that's great, and I appreciate you doing your homework, but I have the responsibility to make sure that all of your diagnoses are accurate, right? I'm not just taking your printout word for it. That's why I went to, 4 years or more of school. So the major differential diagnoses that I think about are hypothyroidism. I suppose we could talk maybe a little bit about that. Hypothyroidism can present, there is such a thing called hypothyroid myopathy, and it looks kind of like fibromyalgia, it looks kind of like polymyalgia rheumatica, and it responds to thyroid replacement. And I've given you some of the differential diagnoses. I'll give you this slide when I